Yes, ma'am. You are co-host now. You can share your presentation.
Yes. Thank you, sir. Thank you for your kind words. Sir has told us that many speakers are going to follow after my today's lecture. But sir didn't mention his name. We are eager to listen to him because the topic he has taken is pranayam and various diseases. So let me complete his list by mentioning his name and the topic pranayam and various diseases. Because as it is happening everywhere in the world, the field is becoming the field of specialization. That way, I feel even the yogic field is becoming the field of specialization. So probably sir is pushing me towards specialization, saying that, madam, your domain is musculoskeletal disorders. But that is what is true. I agree with him that my journey started in 1992 with Dr. S.V. Karandikar as well as Iyengar Guruji. So before I start with my talk, I will first express my deep gratitude towards Iyengar Guruji and Dr. S.V. Karandikar, who have transformed our life, my life, and Mr. Shirish Ketkar, my better half, our life into altogether different life. The journey started in 1992 when my younger son was 6 years old. And the time available for both of us was only 9 to 11 in the morning. Because he was very senior and very high performer, he got a concession of 2 hours late in his office, and my clinic used to start at 11 o'clock. So that 9 to 11, 2 hours, how to spend, rather how to invest, was a big question for both of us. And we started going to both institute, Iyengar Institute as well as with Dr. Karandikar. Because Dr. Karandikar was a disciple of Iyengar Guruji. And this journey right from 1992, so that is almost how many years? 30 years. It's a very long journey. And we are more than happy, more than satisfied, more and more in the deep depth or gratitude with both these personalities. Additional 2 names I will like to mention. One is Senior Hardikar sir, Dr. Sharad Hardikar, who is the eminent orthopedic surgeon, who gave us the opportunity to settle or rather establish our Unnati Yoga Therapy and Training Center way back in 2006. A very senior, eminent orthopedic surgeon believes in this therapy, believes in this conservative approach, was a great satisfaction to me, and that was because he always respected Dr. Karandikar as a scientist. He used to say he is a yogi scientist or scientist yogi. And that gave me courage to start our activity, and he only christened it or named it as Unnati. So Dr. Sharad Hardikar sir, who gave us the opportunity, not only opportunity, he gave us all the facilities. Till 2011, month of March, we were there, and then we came to the present premises. So all these milestones are very, very important. And another important milestone is of Dr. Ramesh Bijlani sir, who is ex-HOD Physiology, AIIMS, Delhi. He has seen my notes of the first book, Rope and Belt Therapy for Osteoarthritis, when both of us went there at Arvinda Ashram, Delhi, to show him the script. And he said, who takes so much of efforts? I said, it is not effort, sir. It is our great emotions which has brought you here, because he had traveled all the way to Pune to inaugurate our conference, medical yoga conference at Hardikar Hospital. So a special mention of Dr. Ramesh Bijlani, sir, who has taught me how to study physiology from yogic point of view. And Dr. Karandikar has taught me how to study anatomy from yogic point of view. So we say yogic anatomy and yogic physiology. And as Ghanshyamji rightly said, we do have a graduation of 4 years of physiotherapy. Why don't we have a graduation of yoga therapy after 12th science? So Ghanshyamji, me and all of you, we should try more and more to put efforts to help the society eventually to establish medical yoga therapy as a streamlined graduation like BPT. Why not BYT, Bachelor of Yogic Therapy? That has to come under all esteemed universities of India. So with this emotion, I'm going to go ahead with the subject. But mind well, today I'm going to talk very lightly and there are no pictures. This is just a thought process I wanted to share with you. The topic is medical yoga therapy with RBT for degenerative musculoskeletal diseases. I have already given one speech, one lecture in search series that was in last year, month of April, May. And that is how we got acquainted. But today I'm going to make it very light just to introduce the basic things. So the first term is what is yoga, as everybody knows, and everybody knows many definitions given by Patanjali, given by Bhagavad Gita, given by Yoga Vasishtha. But this is all philosophy. And I am not the person of philosophy. I'm a hardcore MBBS doctor, still practicing, and I respect my science. So for me, what is yoga? I feel yoga gives us a methodical approach to evolve our personality. Because when we started our study of yoga, we were what age? 30, 35. 35 years of age. We were at the exactly midpoint of our life. If our life is 70, 75 years, 35 is, I consider it as a midpoint. And starting at the age of 35 years, now our age is about 65. What is the journey? My both sons have good education with God's grace and of course parents' blessings. They are happily married. Both of them are having daughters. So I do have 2 daughter-in-laws. And life is so challenging every year. That's what everybody is facing. So how do we face our life? How do we keep our life happy? It is not only you being happy, but spreading the happiness. So wherever myself and Mr. Shirish Ketkar go, we feel it's our duty to spread happiness or waves of happiness. And how is it possible? Abhyasa Vairagya Abhyant Nirodha. So one is Abhyasa and second is Vairagya. So yoga, I feel, is a very methodized effort, very methodized practice, which teaches you at every step of your life to be happy and to make everybody happy around us. That's what is simple way of yoga. But if we talk in terms of neuroscience, then every neuron is connected with other neuron with the help of synapse. That is the meeting point of 2 neurons. They just say hello to each other. And when we say we are practicing, we are doing sadhana. Sadhana is a big word for me. But we are again and again telling our brain, our neuronal circuits, our synapses, what to do and what not to do. Like just now, Ghanshyamji said, what to do and what not to do. Undoing and doing. That's a constant process. And this yogic journey makes it a very easy journey. That's what I feel. So yoga is a process of evolution. Today, I should be a better person than yesterday. And that is how yogic science helps us. That is fine. Yoga is a union of Atman and Paramatman and all those difficult. Samatvam Yoga Uchyate is another. Evolution process is another. What is this medical yoga? What is this funny mixture of 2 sciences? Ancient wisdom and modern medicine. I being the product of both. I think yogic science is in my blood. It is in my genes. Because my father was Sanskrit Pandit. He by-hearted Bhagavad Gita at the age of 80 and went to Shrungeri just to say it, get the certificate, and remaining life he spent in the propagation of by hearting Bhagavad Gita, of course, with understanding. So that is in my genes. Even my mother doesn't sleep without saying Bhagavad Gita. So, but natural, I became a modern medicine doctor, but Bhagavad Gita is in my genes. So what was going to happen? That is what happened. And I started propagating medical yoga in 2006. I feel both sciences should come on one platform. So as to be a good doctor, every doctor should be a good doctor. I always say that doctor's duty is not to give medicines. Medicines are given by even chemist. Chemist gives medicines nowadays. You become doctor not to give medicines. You become doctor to give health. And health cannot be purchased by medicines. For becoming healthy, remaining healthy, medicines are not required. And that's why I feel the two sciences should come on one platform so as to educate the society, so as to counsel with the society. But let me tell you, it is becoming very difficult. I have been taking history of the patient for last 42 years. I'm practicing for 42 years. But now it is becoming more and more difficult because when we ask patient, what's wrong with you? What are your complaints? Instead of telling complaints, they say, मेरे MRI में ये है, मेरे blood reports में ये है, मेरे X-ray में ये है. So instead of telling complaints, they start talking about their investigations, and that is absolutely absurd. So I have to bring them on the track. Please tell me what are your complaints. And once they tell me the complaints, they start narrating. The person in me who studies yogic science and the person in me who has studied modern medicine, allopathy, brings a one wonderful case paper or makes a wonderful case paper where I think on both tracks. Of course, I take detailed history. I go through all the investigations, but constantly at the back of my mind is, am I going to help this patient beyond medicines by my medical acumen? And many of the students are here, the Gnosis students are here. They will remember that before starting medical yoga therapy, we study and we take the oath that we will follow cardinal principles, that we will never start medical yoga therapy without knowing the diagnosis. And diagnosis is the main strong point of modern medicine. The satisfaction, the moment of satisfaction is derived by the doctor when the doctor diagnoses the case. And after diagnosis, then I think whether yogic science can help this patient. And now it is becoming more and more of the need of time because of today's lifestyle. So medical yoga is nothing but the yogic science which is applied with the knowledge of modern medicine. So far, so good. But now what is medical yoga therapy? That is what sir is giving at his Prana Yoga Center. We are giving at Gnosis Medical Yoga. We take minimum 45 minutes to take the history of a patient. And which is taken just 5 minutes in all the clinics nowadays because doctors don't have time to talk with the patient. That is the big difference between medical yoga therapy and medical management or medical treatment. Because even if patient is complaining of knee pain, patient is complaining of low backache, patient is complaining of acidity, patient is complaining of constipation, patient is complaining of varicose veins, patient is complaining of neck pain, we consider the patient as a whole person and not only the part, the organ, the system. No, we consider the person as whole person. Today only I was talking with Gnosis team. Supposingly a girl of weight 43 comes with neck pain, and if a patient of weight 73 comes with neck pain, will your approach be same? Of course not. There are supposingly 10 cases of lumbar spondylosis treated at Gnosis Center. For me, each person is different, each patient is different, and his or her circumstances are different. Age, weight, occupation, temperament, work pattern, food habits. Everything is different in each person. So for me, every patient is different. And that's why medical yoga therapy considers the patient as a whole, one person, and not only his or her complaint. That should be the approach of yoga professionals. That's how we train them. And that's how all the doctors who are doing this course also should look at the patient. Now, sir mentioned about RBT. I'm not going to talk much about RBT, but RBT is rope and belt therapy. Use of ropes and belts was started way back in 1970 by Iyengar Guruji. Very pioneering efforts. And why did he start? Because there are many limitations in performing the postures because of our day-to-day activities. So he started using ropes and belts so as to enhance the effect on thoracic spine, enhance the effect on lumbar spine, enhance the effect at the hip joint position, enhance the effects of opening the hip joint. Hip joint position means opening the hip joint at various places, but mainly the rib cage. So use of rope and belt started by Iyengar Guruji, and of course, medical OPD of Iyengar Guruji is very famous. All celebrities used to come to Iyengar Institute. We have seen them. And what happened later on? Dr. S.V. Karandikar, Shrikanta Vishwanath Karandikar, his disciple, being MBBS doctor, practicing in Narayanpet, a very fabulous clinical practice, clinical acumen, which I have seen while taking the history. He literally formulated this rope and belt therapy approach, mainly for two conditions. One is spondylosis and second is osteoarthritis of knee joint. He used to listen to the patient, see the investigations, and write the prescription in the form of rope and belt therapy. That's what we have seen for 14 years. Myself and Mr. Ketkar were going to learn with him for 14 years. And every day used to be a new day for us. He conducted special training batch also for selective teachers or yoga therapists, so to say. So this rope and belt therapy approach is a unique approach for palliation, that is symptomatic relief, as well as restoration, bringing the skeleton to near normalcy. And mainly for these two conditions, osteoarthritis of knee joint and spondylosis, cervical as well as lumbar. That is what is RBT. What is degenerative musculoskeletal diseases? There are hundreds and thousands of musculoskeletal diseases. They are hereditary, they are infective, they are inflammatory, they are degenerative, they are metabolic, they are neoplastic. So many causes of musculoskeletal diseases. But out of this whole spectrum of so much of etiology, which is most common is degenerative. Nobody can escape from degenerative musculoskeletal diseases because everybody knows degeneration is a process of aging. The cells become tired, cells become less efficient, new cell formation slows down. So the tired, fatigued cells, old cells accumulate more and more, leading to decrease in the efficiency of the concerned tissue, giving rise to degenerative musculoskeletal diseases. So first we have to understand what is degeneration. And the reverse term is regeneration, new cell formation. So does yogic science help in new cell formation? Does yogic science delay the degeneration? My answer is yes. So you remain young. Isn't it interesting? No, who doesn't want to remain young? Everybody wants to remain young. So yogic science helps us to delay the process of degeneration. Here we are talking about musculoskeletal diseases. Basically, what is musculoskeletal disease? The disease which involves muscles and the skeleton are the musculoskeletal diseases. And what is a skeleton? Skeleton is a bony structure which gives shape to the body, strength to the body, stability to the body, movement to the body, and protection of various VIP organs. So we have to study skeleton in deep. What is axial skeleton? What is peripheral skeleton? What is shoulder girdle? What is pelvic girdle? Should be the approach of every yoga professional so as to understand the skeleton. The bones. Then what are muscles? But before that, when we say skeleton, this axial skeleton, peripheral, pelvic girdle, shoulder girdle, whatever I said, number of bones which are present in the body are connected with each other with the help of specific joints. So when we say skeleton, it is the bony skeleton and joints involved. Each bone is connected with other bone to form a joint. So we have to remember the bones, we have to remember the joints, and who moves the joints? They are the muscles. And that's why the next slide is, what are muscles? Now the attendance is great. That's why I cannot ask you a question because I like to make it very interactive. But what are muscles? It's very difficult to answer what are muscles. That way muscle is an organ. Muscle cells are specific cells, unique cells. And muscles are of two types, smooth muscles and striated muscles. That's what we teach in basic course, yoga and modern medicine. Every yoga professional, every doctor should have the detailed knowledge of muscles. So muscles are the organs which cover bones, cross the joint and act on the joint. The striated muscles are voluntary muscles. We can control them by our will and wish, as against the smooth muscles, which are not under our control. We have to know them. The muscles of GI tract, muscles of blood vessels, muscles of bronchial airways, baby bag, uterus. These muscles are not under our will or wish. Nature is very clever. All VIP things, all vital things nature has kept under his control. So what are muscles we should remember? And in addition, to make a mention, it's the heart muscle. Heart muscle is a very smart muscle because it takes the property of striated muscle in the form of strength and independence in the form of from smooth muscle. So it combines the properties of both. It is striated involuntary muscle because it has to have strength. Heart pumps our blood, 5 liters of blood per minute for minimum 75 years of age, and that is something miraculous. So what are muscles? Basically, we should understand. How do they work? What are their types? And as I said, when we say something about skeleton, we have to mention the joints, the range of movement, flexibility and stiffness. These are the terms which are very commonly used. Who knows elbow joint? Who knows wrist joint? Who knows ankle joint? I'm conducting this course for how many years now? 2006. So 16 years. And our medical yoga therapy course has always a combination of yoga professionals and doctors. And if I ask them, Dr. Pooja, will you tell me how the ankle joint is formed? She feels very sad and bad because she cannot answer. Because we study anatomy in first year and then we forget. Because second year is pathology, then pharmacology, then forensic medicine, then surgery, gynecology. So many subjects are there. So poor anatomy is forgotten. If we yoga professionals are performing postures, practicing postures, we are practicing Virabhadrasana, we are practicing Parshva Konasana, we should know what is ankle joint and what is the movement at ankle joint. What is the range of movement at a particular joint? So yoga professional has to study a lot so as to understand the function of muscles, function of joints, and what is the range of movement at a particular joint. Then only we can talk about what is flexibility and what is stiffness. Many times we just say the words without understanding or without defining them. I always like to define the thing. Define flexibility, define stiffness. Decrease in the range of movement will be stiffness. Then how does it increase? When the stiffness reduces, flexibility improves. But how does it happen? What is the pathway? We have to study from those point of view. So coming to muscles, again the same word, my joints has become stiff because my muscles are stiff. But why your muscles are stiff? I don't know. The muscles become stiff because they shorten themselves. All Gnosis students will remember that they undergo adaptive shortening. If my shoulder joint is constantly near my body, the all muscles surrounding my shoulder joint are going to shorten. And this shortening leads to stiffness. And for that matter, I have to use my each joint in full range of movement. So whatever muscles are shortened because of my day-to-day activity will be nicely elongated, will be stretched. Everybody knows yoga is stretching. But that is a big insult to yoga. When somebody says yoga is stretching, I really feel bad. I feel like crying. Yoga is not only stretching. Yoga is just 0.1% is stretching. But coming here, definitely, we have to stretch the muscles which have undergone shortening so that the stiffness reduces and flexibility increases. Another term which is commonly said is spasm. What is spasm? Can yogic postures practice help me in spasm? So for that matter, you have to understand exact definition of spasm. It's a sustained contraction, involuntary contraction, reversible contraction, protective contraction. So what is the definition of spasm? It's reversible, protective, sustained, reflex contraction of striated muscle. Many muscles undergo spasm because of various reasons. So does the practice of yoga help in prevention of spasm? That is a study. With this little background, what do knees suffer from? Our knees may suffer from osteoarthritis, and our spine may suffer from spondylosis. Why? Why knees suffer and spine suffers rather than all other joints? That is the study. Why knee suffers, not hip joint and ankle joint? Because knee joint is an incongruous joint, mismatching joint. The bony surfaces which take part to form knee joint are not matching with each other. That's why the weight transmission and weight distribution is not proper, and hence knees suffer. We teach knee osteoarthritis for how many hours? 30 to 40 hours we are constantly talking about osteoarthritis. It's a very big topic. It's a very huge topic. But what is the message? We are going to see the message in the next slide or following slides. It is a degenerative disorder because our topic is degenerative musculoskeletal disorder, osteoarthritis of knee. Into pain and patients.
Hello.
Ma'am, you are on mute.
Still on mute, ma'am.
Ma'am, you can continue. Hello. Madam, we
Sir.
can't hear you. You are on mute. Unmute yourself.
Am I audible now?
Yeah.
Yes.
Yes.
Okay. I don't know what happened. Is it okay?
Yes, ma'am.
Okay. So coming to spine, we have seen that knees suffer leading to osteoarthritis, which is rather inevitable for everybody. But the golden question is, can we prevent? Can we delay? And same is the case for spine. Spondylosis. Why the spine suffers from spondylosis? That is again a degenerative condition. Why? Because both knees and spine are weight-bearing structures, weight-bearing skeleton. The joint of two adjacent vertebrae, including the disc intervening, is weight-bearing. So because of constant weight-bearing, the degenerative process starts as early as 20-25 years of age. So that way everybody's spine undergoes degeneration. But becoming symptomatic is because of our negligence. So degenerative changes are inevitable, but we can take care of our knees and spine not to become symptomatic and to enjoy and rather maintain the quality of life by saying delay osteoarthritis and prevent spondylosis. By practicing selective yogic postures, which we teach in our RBT program, which are aiming at stretching of selective muscles and strengthening of selective muscles, we aim at proper weight transmission and weight distribution at knee joint. That is the way all yoga professionals should talk. Practicing Tadasana is for proper erect posture with awareness. Sir started the meeting or the lecture or the program with the word awareness. So what is awareness is nothing. How to carry your body, how to sit, how to stand. What should be the awareness so that your line of gravity will pass through the joint with proper distribution. So right from your cervical spine to thoracic spine to lumbar spine, then at sacrum, weight going to hip joints, knee joints and ankle joint, and then to the foot. The whole weight transmitting axis or the mechanical axis is well understood or should be understood by a yoga professional. And if we practice yogic postures, like Sir said, which postures to be done for knee care? They are entirely different. I do yoga every day, that's fine. But which postures are to be practiced for knee care? What is to be done and what is not to be done should be learned. That is what is medical yoga or medical yoga therapy. So also prevent spondylosis. Can we prevent spondylosis? Of course we can. But for that matter, we have to do servicing in the form of again practicing selective yogic postures. Not all postures for everybody. All postures for everybody is a wrong way of practicing. Everybody's body, everybody's temperament, everybody's weight, I told you the muscle mass is entirely different. So all yoga professionals, all doctors should learn which postures to be practiced for knee care, which postures should be practiced for spine care, so that I can prevent spondylosis. I can delay osteoarthritis. Can it be done? Definitely it can be done. That is what is medical yoga therapy. Palliation, if at all, in spite of this, or probably I have not practiced, so I start getting knee pain. Maybe at the age of 35, 45, 55, 65, 75. Patient may come to you in any range of age. So advising the X-ray, looking at the X-ray, taking the history, and then correlation of the X-ray with clinical presentation, so as to give pain relief without giving pain relieving medicines is a big task. And can you do it? As sir has said, yes. Sir has experience in last 1 year. He has treated many patients of ONE as well as spondylosis, and he is more than happy about it. So palliation is a symptomatic relief. Relief from pain, relief for stiffness can be achieved by practice of selective yogic postures, which we call them at-home yogic postures, because they are to be learned by the patient and practiced at home. That's why we call them at home, which has 2 sets, phase 1 and phase 2, stretching and strengthening. But these are highly selective. Now, many yoga professionals come to me with low back ache. Why? Because they are doing lot of back bends. Practicing lot of back bends always injures the lumbar spine. That should not happen. How to take care of lumbar spine? It's crucially important for all yoga professionals, so that we should not have any lumbar pain, because once a lumbar pain, it is really troublesome. But however, if one has it, then palliation, symptomatic relief is very, very important, and it should be given in a predictable way, because patient immediately asks, कितने दिन आना है और कितना फर्क पड़ेगा? These are the 2 questions. कितने दिन आना है और कितना फर्क पड़ेगा? Just now before the lecture, I had one consultation. Patient asked me this question. मुझे अगर पुणे आना है, सांगली का पेशेंट है, पुणे आना है तो कितना दिन आऊं, और डॉक्टर मैडम बताइए मुझे कितना % में फर्क पड़ेगा? So for that matter, constantly you have to work with the patient, give services, take follow-up, so as to find out, so as to gain confidence कि एक हफ्ते में 10 to 20% फर्क हो जाएगा. अगर जल्दी आए तो जल्दी फर्क पड़ेगा. But palliation is very, very important. Patient's pain should be reduced. Then only patient will believe in you. Symptomatic relief. Restoration of knee and spine to near normalcy is a big task, because usually relief of pain and stiffness occurs within 1 or 2 weeks, or even 3-4 weeks for that matter if it is severe. But bringing the knee to near normalcy and bringing the spine to near normalcy, patient has to continue whatever patient has studied for whole of the life. अभी ये सीखा तो है डॉक्टर, कितने दिन करना है? तो आपका आंसर होगा जिंदगी भर करना है. तो उनको तो शॉक में जाते हैं, वो जिंदगी भर करना है. कैसे नहीं जिंदगी भर करना है? ये तो सर्विसिंग है. तो आपके नी की और स्पाइन की सर्विसिंग करने के लिए आपको कम से कम 15 मिनट्स 20 मिनट्स रोज देने ही होंगे, in the form of stretching and strengthening. That should be your way of talking. And that way you can conduct knee workshops, knee care programs, spine care programs specifically. And for that, you will have to study your muscles and joints, and patient's muscles and joints, so that you can apply this knowledge. And for that, we learn and we study and we teach is yogic anatomy. Yogic anatomy is entirely different than our medical anatomy. That makes this study very, very interesting. Sangeeta Masoor is there. She is a practicing doctor from Mumbai. She answered today very nicely. What is the action of pectoralis major we were discussing, and she immediately answered. That is what is yogic anatomy. That is not taught to us in medical college. A muscle works at both its ends. So maybe one end is more important for our day-to-day movements, but the other end is equally important or more significant for yogic action. That is what we were studying about serratus anterior. Iyengar Guruji and Dr. Karandikar always used to say, Bhoga and Yoga. Bhoga occurs at periphery and yoga occurs in the center. They always used to say. So this is what is yogic anatomy. Even for simple muscles, you have to understand the muscle from different perspective so that you can work on the muscle and use the muscle for your betterment. That's what we call yogic anatomy. For every muscle, we describe medical anatomy and yogic anatomy. That makes the study very interesting. Like for latissimus dorsi. Latissimus dorsi gets stretched in many forward bend postures. Today only we were discussing. But how does it help? Why does it help? That is the way you should study. Application becomes the goal then, because the patient who comes to you has specific complaint. Not all patients come to you with osteoarthritis or spondylosis. But here and there, dull aches and dull pains because of this stiff girdle, either shoulder girdle or pelvic girdle. Makes them simple actions also difficult. Turning in bed from one side to another, getting up quickly, walking fast. Speed of walking remains the same at the age of 65, 70. It's very enjoyable. So ultimately, why we are studying yoga, medical yoga therapy is to maintain the quality of life. Now, supposingly one patient came to me who plays table tennis as his passion for last 20 years or 10 years when he retired from Telco, I think, Tata Motors. His X-ray was taken, osteoarthritis grade 1, grade 2, grade 3 early, we treat with rope and bell therapy. An orthopedic surgeon told him, even for grade 1 or 2, don't play table tennis. Now, don't play table tennis for a person whose pleasure is table tennis. Doesn't make any sense to him. He wants to play table tennis. That is what is the pleasurable activity during the day. And if your doctor tells that don't play table tennis, then what is the big point that has he become all right? Has his knees become all right because he cannot play table tennis? We yoga professionals, we doctors should say, okay, play in moderation, just 10 minutes, one small game, enjoy it, meet your friends, take a break, another one game, that's it. And that much of knee fitness we should give him. That is what is happening in my OPD. This is what we call functional fitness. This relief of pain doesn't mean the knee has become all right. The knee has to work for the pleasurable activity. And that is why application is the goal. And that is the best part. Because ultimately, this is my last slide. Ultimately, age depends on movements and erect posture. If I don't move, I feel I am becoming old. My mother is 85 years old. She's still moving like a very efficient person with erect posture. She's a role model for me. So we feel age has stopped for her at the age of 85. And movements depend on knee joints and erect posture depends on spine. So age becomes just the number, provided we take care of our knees and our erect posture. So we can be young at knees and spine by practicing yogic science. Because as Sir said, yogic science doesn't help or doesn't work only on Annamaya Kosha, but it works on the other koshas as well. Pranamaya Kosha, Vijnanamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, and then going to Anandamaya Kosha. So like Sir said, in yogic science practice, we work on our body for muscles and joints. We work on our breathing. That's why we teach guided breathing. Working on breathing is working on emotions, working on thought process, working on perceptions. That is what is pratyahar. And that's what slows down the degenerative process as well. So this whole journey is so interesting that there are no words for me to talk about it. So let us be all young at knees and mind by practicing yogic science. Thank you so much. Thank you, sir.
Yes, ma'am. Thank you so much. Very, very exciting and very, you can say, principle-based session.
Thank you, sir.
Yes, we all enjoyed. Thank you so much. Dear friends, the whole objective of this course is to start a very good yoga therapy course. eh? And that is whole objective ki with the help of, you can say, prana yoga and medical gnosis, we are starting a very exhaustive, very detailed 6 months course on yoga therapy, which includes everything. Bhagavad Gita, Patanjali Yoga Sutra, Yoga Vasishtha, philosophy of yoga and practice of yoga. You can join part of the course or you can join full course. Part of the course means, for example, you are interested only in anatomy. Then you can join only in that medical yoga part of that course. But if you join full course, then full course involves the certification. And this certification will be provided by Government of India. So no doubt. So this that is the YCB level 6 yoga therapist course and level 7 therapeutic yoga consultant course. If you want to know anything about the details of the course, I have posted 2 telephone numbers, 2 mobile number on the chat box. One is number of Erita, that is she is coordinator for Mumbai Center, and Julie, she is a coordinator from Pune Center. So you can contact any of them to know details about the course. With this, we will end up with the final prayer and we will meet tomorrow again at the same time. Om Namah Shivaya. Thank you so much. Om Purnamadah Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vasishyate. Om Shanti 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 Harihi Om. Okay, thank you so much. Looking forward to meet you tomorrow at the same time. Good night.
Good night. Thank you, sir. Good
Thank
night.
you.
Good night. Thank you.